Postural orthostatic tachycardia syndrome. Postural orthostatic tachycardia syndrome. Okay, one of our previous students had this, and she didn't come back for the second half, so she can't tell us about it. But anyway, postural orthostatic tachycardia syndrome. When you get up too quick from a chair or from lying down, all of a sudden, boom, 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 heart starts going like crazy, right? Tachycardia over 100 beats per minute. Yes, and that is another syndrome. And that is poor control, poor autonomic control, right? Autonomic, sympathetic and parasympathetic out of balance, right? And such to keep everything working well. And in some people, for some reason, this happens to them and they go into tachycardia. And you feel your heart boom, 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 which is fine if you're climbing a mountain, but not if you just were sitting in a chair and get up, okay? So pretty interesting, pretty interesting. It's usually, by the way, young females that have this, usually, okay? All right, that concludes that. Now let's talk about chapter 19, the lymphatic system, okay? The lymphatic system, right? You know, the circulatory system, you got your arteries, you got your veins, right? The blood makes a circle and comes back, right, to the heart, then to the big toe again, and then back to the heart. But the lymphatic system is a little different. It's not a circle. The lymphatic system picks up lymph, picks up interstitial fluid, right? And it deposits it, boom, and it dumps it into the bloodstream, okay? Now, let's talk about this from last chapter, right? We talked about basically with the heart beating, boom, 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 causes hydrostatic pressure, right? Blood pressure. When the heart squeezes, pressure, right? Okay? Now, when we get to the capillary beds, it's about 35 millimeters, okay? By the time it comes out of the capillary bed, it's 17, okay? So, in a normal person, about 20 liters every day of fluid, 20 liters, right? Gets dumped out. However, about 17 liters gets reabsorbed, okay? So, and we said if that situation continued for a long time, you just swell up, right? Because 20 is greater than 17, right? What happens to the other 3 liters? The other 3 liters is picked up by the lymphatic system. That's what we're going to talk about tonight, okay? And we talked about, this is the arterial end here, and this is the venous end here. And we talked about the balancing of the pressures, right? Hydrostatic pressure is pushing, right? However, in the blood, there's protein and other solutes that cause osmotic pressure. So the hydrostatic pressure and the osmotic pressure do this. And oh, by the way, the interstitial fluid, the fluid outside the blood vessels, right around the cells, that interstitial fluid exerts, a little bit, 1 millimeter, a little bit of pressure, right? So if we add up all the pushing forces, the hydrostatic, team hydrostatic, right? And then we subtract all the, right? The water gets sucked back into the blood vessels, right? Remember the tube? Right? We talked about that. And so when you add up all the pushing forces and all the sucking forces and subtract them, we get 35 plus 1 is 36 minus 26 plus 0 is 26. 36 minus 26 is 10. So the net filtration pressure on this end is 10 more millimeters of pressure pushing fluid out. That's why 20 gets pushed out, okay? There's more pressure pushing out. Conversely, when we get to the other end, when we get to the venous end, right? When we get to the venous end and we add up all the forces, that 35 is about cut in half to 17. 17 plus 1 minus 0 plus 26 equals minus 8. And the key is that minus there means it's a sucking force. It's bringing the blood back in, okay, the fluid back in, okay? So when we do that, the net filtration pressure here is plus 10 and minus 8. And the disparity between those two is the reason that 20 gets pushed out and 17 gets sucked in, okay? Right? There's a lovely graphic in the book. You can go over that. But basically, you add up all the pushing forces that are pushing blood out, and all the, or fluid, I should say, and then all the osmotic forces that are pulling it back in, right? And in an ideal world, we don't swell up and we don't dehydrate either, right? Yes? And such. And so that's what that diagram is about, okay? Now, let's talk about these 3 liters here. And let's talk about the lymphatic system, okay? The lymphatic system. Okay? Now, the lymphatic system returns fluids that have leaked from the blood vasculature system back into the blood, okay? Okay, we talked about that. As much as 3 liters becomes interstitial fluid, and the interstitial fluid and the plasma proteins are returned to the blood to keep the blood volume up, right? The volume of blood would go lower and lower and lower if that didn't happen, okay? Now, let me, right? The lymphatics are blind-ended, meaning, you know, you got an artery that goes into a capillary bed that comes out a venule, right? But the lymphatics are not there. The lymphatics are right next to these capillary beds, right? And we have these little microvalves, microvalves. We have these little microvalves, right? At this point, they're very thin. Now, the lymphatic system does have the 3 tunics that we talked about with the blood vessels, right? Tunica externa, tunica media, and tunica intima, right? The innermost layer. But when they get down to their smallest version, basically, and I just drew one here, there are many. But anyway, there are also little strings here, protein strands, I should say, that tie everything down. But what happens is this: how does the lymphatic pick up those extra 3 liters? Okay, the lymphatic picks up those extra 3 liters because it's all about the pressure, right? So the valve basically is like this. Yes. Okay, like this, right? And so think about this. If there's there's pressure inside the lymphatic, and there's pressure outside the lymphatic, okay? Now, with this valve, it will do this, okay? Very simple. Now, tell me what's going to happen if there's more pressure outside of that lymphatic. What's going to happen to the valve? If there's more pressure outside interstitial fluid, if the interstitial fluid pressure, PIF or such, is higher than what's on the inside of the blood vessel, what's going to happen? Not the blood vessel, the lymphatic, pardon me. What's going to happen to the valve? It's going to open. If there's more pressure outside, it's going to open the valve to equalize the pressure, right? Does that make sense? If there's more pressure outside, right? It's all about the pressure, girls. I'm telling you. You got to watch for that, huh? But anyway, if there's more pressure outside, it's going to open, and the pressure is going to be relieved by fluid flowing in. Conversely, inside that lymphatic, if there's more pressure inside, what's it going to do? It's going to close that valve. So the valve is going to open or close depending on where the pressure is. Okay? If there's higher pressure here, higher, then the valve's going to open. If there's higher pressure here, the valve's going to close. Right? It's not complicated. It's not complicated. Right? Okay? So, again, it's all about the pressure. Blood goes through the heart by the pressure, going from high pressure to low pressure. Blood goes either into the lymphatics or does not go into the lymphatics, depending on the pressure, right? Because we have this extra 3 liters, there's more pressure here. It's going to push, and the valve's going to open. And blood will flow, I keep saying blood, interstitial fluid will flow in here, and this lymphatic fluid from the interstitial fluid, right, is going to flow back and eventually get dumped in the heart. We'll talk about that in a minute. But does that make sense that if there's more pressure outside, valve opens. More pressure inside, valve closes, right? Yes? Okay. Neighbor across the street, the sewer line would get blocked up in the alley. And guess where it would block up? Back up into her basement. Can you imagine? Happened several times, right? So what did she have to do? She spent some money, and they dug down, and they put a little box, and the box has a flapper valve on it. And the flapper valve, when water runs out of her house, it opens up and it runs into the main sewer. If the main sewer backs up, guess what? Shuts the valve, and she does not get a basement full of other people's, you know what, right? Right? Same principle here. Yes? If there's more pressure here, fluid goes in. If there's more pressure here, the valve closes. Fluid doesn't go in. It's very simple, okay? But anyway, right? Need you to get that. So let's talk about, okay, they're blind-ended, right? They don't turn into something else like an artery to a vein. They are blind-ended, okay? We do not have them, think about this, in the bones, there's no lymphatics. In your teeth, no lymphatics, right? In your bone marrow, there's no lymphatics, okay? Or in the central nervous system. The central nervous system has its own system, right? The ventricles and all that, the CSF, okay? And again, these flaps, they're endothelial cells, right? Endothelial, right? Where the inside meets the outside, endothelium, right? The lymph capillaries are called lacteals, 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 okay? And there are a bunch of lacteals to our GI tract. Okay, let me explain that. Right? When we eat fat, and fat gets broken down, the molecules many times are big, and they're too big to go across the endothelium of the GI tract. Mainly absorption, we'll find out, or we'll study, is in the large intestine, usually, pardon me, small intestine. That's mainly where we absorb our food, okay? And so what happens is that these molecules are so big in fat, guess what? They go through the valves into the lymphatic system, okay? And the lymphatic system is going to drop in the thoracic duct, okay? Okay. These lacteals transport absorbed fat from the small intestine to the bloodstream. Okay? They dump the fat in the blood, basically. Right? Okay. Again, from the tiny vessels to the larger vessels to the large lymphatics. Okay? Now, if we look at a person, right? If we look at a person, yes. Okay, there's a lovely diagram of this, but what happens is that okay, what happens is this, right? Here's your heart, here's the aorta coming off. I think the third one is subclavian. I can't remember exactly, but anyway, basically right there, close to that, is where the fat gets dumped into the bloodstream, okay? And so what happens is that you have one on each side. Where it gets dumped into the bloodstream is called, on the left side, the thoracic duct, or I guess more specifically, the left thoracic duct. But notice all this area that's shaded, okay? Right? It's the main one, the left thoracic duct. Hence, many times we just say the thoracic duct. On the right-hand side, what does it drain? The right side of the head and the right upper extremity here, right? But 3/4 of the body, it's all the left side, okay? Let me just a minute, I'll tell you. Figure 19.2, the lymphatic system, figure 19.2, okay? The thoracic duct and the right lymphatic duct, okay? Make a star in your notes. Make sure and look at that, because I may ask you, your big toe is drained by your right or your left thoracic duct. Ms. Keith. Gotta be your left, right? Both big toes do, right? Because of this diagram, there's only a small part, 1/4 of our body, the right side, upper, and the right side of our head, right? Is drained there. 3/4 of our body, left, and all the bottom, below the diaphragm, right? Yes? Actually, it's across here. But anyway, if you notice that from the picture, their picture's better than mine. What can I say? Yeah. So, I may ask you, the right arm is drained by the right thoracic duct, right? Or the right big toe is drained by the, which duct? The left, right? Because all the bottom is drained by the left, and the left-hand side is drained by the left. See? So it's interesting, it's not equal, is what I'm saying, right? Both ducts dump into the venous circulation at the junction of the internal jugular vein and the subclavian vein, okay? Now, let's talk about this. Have you ever had something that you got cut, or you got scratched, or you scratched a mosquito bite and it got infected and it got red and irritated, right? And when things start to spread, you'll get the red streaks. Okay? When something gets infected, you look, if it's bad and it's not treated properly and soon, then you'll get red streaks running from it, okay? And that's called lymphangitis. Remember, our blood vessel, in the outer layer of the blood vessel, right? It's got lymphatics, so thick ones, right? And that's called the vasa vasorum. The vessels of the vessels, right? Yes? So, if the vasa vasorum gets swollen, infected, and it's having trouble draining, then you'll get red streaks running from the wound, and that's a bad deal. That's a very bad deal. And as a general rule, the treatment is, of course, they're going to give you antibiotics, but they're going to immobilize that arm. They don't want you doing this and moving it around and sending that germs all throughout your body. You don't want it systemic, right? So, let me see what I wrote down. Vessels, large vessels have the vasa vasorum. When severely inflamed, the vasa vasorum becomes congested, hence the red streaks. You can see them visible through the skin as red lines, and they're very tender to the touch, okay? And again, if it's badly infected, then they're going to immobilize that body part, so the inflammatory bad germs don't go out. Systemic, the whole body, okay? Now let's talk about, make sure you get, right? This is from an infection and lymphedema, 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 right? This is from blocked lymphatics, right? Blocked lymphatics, okay? And so lymphatics can get blocked by a tumor, or much more commonly, what happens is that it happens in ladies who've had a mastectomy, right? Whenever they do a breast biopsy, they always check the lymph nodes, right? The lymph nodes, to see if the cancer has spread, right? If they do a mastectomy, when they cut the breast off, then what happens is that many times they damage the lymphatics, right? And we know the 20 versus 17 and the 3 that gets picked up. But if the lymphatics are damaged, it's going to swell up and get bigger and bigger, right? And we talked about that many times. After a breast surgery, lady has to wear a garment that squeezes her, and that's called lymphedema, right? The PT folks treat this, and they go to special classes to learn how to deal with it. And certain times, after a period of time, it will come back and reestablish, but many times no. I mean, I had one patient that I remember that she had to wear the garment for years, and it was dark brown, looked like her skin, but she always had that on in there. If she wore short sleeve, you could see it from here to there, usually squeezing to squeeze the lymph back, right? Okay, lymphedema. Make sure you get the difference. Lymphangitis, infection, red swollen streaks from a wound. Lymphedema, blocked lymphatics, swelling from that, right? Okay. Just a little bit about the lymphocytes, and we're going to talk a whole bunch about them in the next. The T cells and the B cells, right? Okay. Okay, the T cells. It's a form of lymphocyte, and the T cells, what they do is they will directly attack infected cells and kill them, and they also will kill cancer cells, okay, the T cells, right? They also activate the B cells, and we talked about the B cells have a special name called plasma cells, and what's so special about the plasma cells is the plasma cells make antibodies. T cells do not make antibodies. The B cells, right? Oh, by the way, antibody has a B in it. Antibody, B cells. That's how I remember. You remember any way you can, right? But anyway, that's the difference. And we're going to talk a whole bunch about those in the next chapter, okay? But anyway, the B cells and the T cells. The B cells produce the plasma cells, the daughter cells that secrete antibodies into blood and other fluids. Okay? And antibodies mark the antigen for destruction and phagocytosis. Okay? So we talked about the B and T cells. Let's talk about the macrophages. M-A-C-R-O-P-H-A-G-E-S. Macro means big, right? Macro means big. Phage means to eat. The big eaters, right? They're phagocytes, right? Here's a germ. Phagocyte shows up, right? It'll send pseudopods around, and next thing you know, it will swallow it up. And then, generally you have lysosomes inside the cell that are going to have enzymes. It's peroxide, right? What do we kill germs with? Peroxide. That's what's in a lot of the lysosomes, peroxide, okay? H2O2, I believe it is, right? But anyway, the macrophages, right? Okay? And remember too, these macrophages, they're called monocytes. Monocytes. They're one of the lymphocytes, but when they go into the tissue, we call them macrophages, right? When in tissue. Okay? When this macrophage goes into when this monocyte goes into the macrophage, right? Remember last time we talked about the monocytes, mononucleosis, and all that good stuff, right? Well, anyway, when they go into the tissue, they're called macrophages. Big eaters, right? Yes? Okay. We have another type of cell called dendritic, D-E-N-D-R-I-T-I-C, dendritic cells, right? And those dendritic cells capture antigens and take them into the lymph nodes, okay? Okay. Okay. Inside a lymph node, basically, they're like strings of protein, a structure, right? And the next one after dendritic is reticular cells. And these reticular cells make this structure, and the dendritic cells will have them, will bring them there and attach there, so they're dissolved, basically, so they're taken care of, right? And, oh, by the way, the T cells, a lot of the T cells are in the lymph nodes, the actual lymph nodes, sitting there waiting for the germs to come so they can eat them, right? But there's a small amount of the T cells that circulate all the way around with the blood, right? And they do surveillance. They look, and look for germs, right? Oh, by the way, what is one way to get those T cells revved up and looking around for germs to kill, right? Exercise. When you exercise, it sends the heart's pumping that blood all the way around, right? And those T cells are going all over your body to look for infected germs. Okay, so that's one thing that will enhance the T cells. Yes? Now, like anything else, if you exercise too hard, you can't get sick. After guys run a marathon, by the way, it's common that they will catch a cold. They go around shaking hands with the other marathoners, and their immune system is down because they just run 26 miles, right? Yes, but as a general rule, exercise increases your immune system, okay? Right? But not extreme. They also found that if they give them a little vitamin C after a marathon, less of them will get sick with a cold or upper respiratory, right? So, like me, when I go climb a mountain and I come back, I'm taking extra vitamin C, and I'm like going crazy, right? After I shake hands with people at church, then I'm sitting there cleaning my hands immediately afterwards, right? Because I don't have time to get sick, I just don't have time to get sick. I'm not being rude, you know, but I don't have time to get sick. Yes? Right? I remember Dr. Dr. Sneederjohn was here for a time, and I was sitting there, and they did the, oh, everybody shake hands with everybody, and I sat down, and I'm cleaning my hands. He was sitting next to me, and so I handed him, oh, you want some? He goes, oh, no. And he realized what it was. Oh, yeah, I want some of that, too. Right? So, okay. But anyway, it's funny. He didn't realize what I was doing, and then he realized, oh, yeah, I want some of that, too. Okay? The reticular cells. Yeah, R-E-T-I-C-U-L-A-R, reticular cells. Okay? Yes? And they are fibroblasts. Fibro, B-R-O-B-L-A-S-T-S, right? And they make this structure. I didn't give you the name of it yet. It's called the stroma, okay? Stroma, right? And, okay, think about this. When I was a kid, right? When you got a mattress, it had wires in it, and then they stuffed cotton around the wires, and then they sewed the covering on it, right? Yes? And so the wires were kind of like the stroma. They're the structure of it that held the cotton in, right? And such. And then it sucked when the wires broke because they would poke through, and you'd have to get a pair of needles on those wires and pull and cut it off, and hopefully it wouldn't poke you again. But anyway, right? Reticular cells make up this stroma. Oh, by the way, when we talk about the spleen, same thing, has a stroma like that, okay? Here we're talking about lymph nodes, okay? Okay, very important. Where do the lymph nodes cluster? Where do we have clusters of lymph nodes, right? Where do we have clusters of lymph nodes? Okay? Number one, yes, you're right there, but we're going to start here at the top, right? Remember sternocleidomastoid, right? Right in front on each side. We have a lot of lymph nodes in here, and they swell up when we get a bad cold or flu or something. They'll swell up, right? Okay? So cervical in our neck. Number two, bunch of lymph nodes under here, right? To do a proper breast exam, one of the places that you do is you feel their armpit, right? Sometimes when I'm doing a new patient exam on a lady, then I'm like, sorry, I got to stick my hand in your armpit. And I stick my hand up there and feel for big lymph nodes, you know? And they're like, why are you doing that? I'm like, I'm checking for swollen lymph nodes because you have breast cancer. Oh, okay, that's good, right? Then I have to go wash my hands because it's fun this time of year, stick your hand in someone's armpit. But anyway, right? Yes? Inguinal, right here in the groin. Very common here and down here too. Right in here and right in here. Yes? If you get infection in your leg, guess what? These lymph nodes will swell up. Okay? Let's see. Yeah, inguinal, axillary, cervical. Right? Yes? Okay. The lymph nodes filter the lymph. They are filters. Okay? They catch germs and they give the B cells and the T cells time to kill the germs. And let me explain a little bit about the lymph node. Okay? Afferent, efferent. Okay? Notice the way I drew that. If you notice, I drew 1, 2, 3 afferents going in, right? Afferents. Remember efferent from down the other way. Okay? Out, efferents. Notice I drew 3 here and 2 here, right? Have you ever been to a concert and you're going in, and there's like 1, 2, 3, 4, 5, 6 sets of doors, right? But when you go in, they only open 2 of the doors, right? And they got people standing there that want to see your ticket to make sure you bought a ticket, right? And so what happens is everybody backs up because there's only 2 doors open, right? Yes? In the same way, there's more afferents than there are efferents. What does that do? It makes the lymph back up, it slows the lymph down, and it gives the lymphocytes in those lymph nodes time to kill the germs, okay? And it's very common that lymphatic fluid may have to go through 2 or 3 or 4 lymph nodes by the time it gets back to the heart. It's kind of like, here's a filter, here's a filter, here's a filter, and the fluid finally comes out, right? Yes? So, and that is for cleaning, but make sure you get that. More afferents than there are efferents, okay? Okay. Okay. Because there are more afferents than efferents, the fluid stagnates, allowing time for the lymphocytes and the macrophages to do their work. And again, it passes through several nodes before lymph is completely cleansed. Okay? Now, let's talk about another situation. Okay? Let's talk about another situation, and that is the name for a big swollen lymph node, okay? Okay. The name for a swollen lymph node is a bubo, right? Does that remind you of anything from history? Does that remind any history students in here? Does that remind you anything from history? Yes? About the Middle Ages? You want to tell me what it was? The bubonic plague, right? Yes. A swollen lymph node is called a bubo, right? Bubonic plague caused by Yersinia, S-I-N-I-A, Yersinia pestis, right? Right? The lymph nodes swelled up really big and turned black. Bubonic plague, the black plague, right? Yes? Okay? Now, cancer, we said when a woman has a breast surgery, they always check the lymph nodes around that, right? To make sure they're clear, yes? Okay? So, cancer cells can be spread when we say the word metastasize. They can metastasize through the lymphatic system. That's why they always check the lymph nodes when they're doing because the breast is very close to the axilla, right? Yes? And such, okay? Cancer cells enter the lymphatic vessels and become trapped there, okay? Swollen, painful. Swollen, non-painful lymph nodes. Right? Have you ever had swollen lymph nodes? Maybe you got a way bad sore throat. Yes. Right? And they hurt to swallow and this and that. So generally, when lymph nodes swell up and get big and they're painful, then we usually think that's an infectious process, okay? That's an infection going on, right? Right? Because we're going to talk in a little bit the tonsils or lymphoid tissue. But anyway, okay? So that's generally an infection. However, if you have a big swollen lymph node and it doesn't hurt and it doesn't cause any pain, then you're more concerned that you're dealing with cancer, okay? This is probably an infection, and this is, I don't want to say probably, I'm going to say possibly cancer. Okay? Now, the exception being that when I was a kid, I had the bad sore throat several times, like all kids do, and I got a lymph node right up under here, and it's a little bit bigger than a pea, right? And if your body has a real hard time getting rid of the germ, it will wall that off and calcify that lymph node to just basically close it up. Okay? So I got a small lymph node up under there that's been there the last, 40-something years. Right? So that's no big deal. But if you got a lymph node and it's not painful and it's swollen, and especially if it grows, that's when you got to be worried or scared. Okay? Okay. Right? But it can just be calcified. We'll talk about in the respiratory chapter how TB, tuberculosis, it'll form granulomas in the lungs, and they'll be there for years and years and years. Okay? Well, till you die. Okay? Now, quickly, let's talk about the lymph, the spleen. Okay? Some of the other lymphoid organs, right? The spleen. Okay? The spleen is on the left side of the abdomen, and it kind of curls around the top of the stomach. Okay? Okay. It's the site of lymphocytic proliferation, right? Lymphocytes grow there. It is a site of immune surveillance, right? Where the T cells and the B cells are looking for germs, right? The spleen cleans the blood. It takes the old red blood cells and it breaks them down, and it recycles them. It recycles the iron and the hemoglobin and such, okay? There are a lot of macrophages, right? Remember the big eater, macro, big, phage, eating, right? The big eaters. There are a lot of those on those reticular fibers sitting there waiting to kill germs in the spleen, okay? The spleen stores the breakdown products of red blood cells, okay? It also stores blood platelets and blood platelets, right? The platelets are thrombocytes, right? And the monocytes and the platelets, when you need them, they'll be released. Oh, by the way, certain people will, before their sprinters and such, they will do a couple of breaths, hold the breath for a long time. And when you do that, it'll cause contractions of the spleen, and red blood cells will come out of the spleen, and I think it makes them run faster. But anyway, I heard one guy talk about it, the spleen. It's your blood bank. It's your blood bank in your body, right? And if you get hit hard enough and the spleen ruptures, it will bleed big time, right? Okay? Now, in the spleen, you have white, W-H-I-T-E, white pulp, and red pulp. The white pulp is the immune part of it, right, with the T cells and the B cells, and the red pulp that's where you recycle the RBCs, right? So you got your breakdown products of an RBC. Remember? Anybody remember the lifespan of a RBC? Very important. You might want to remember that coming midterm. The lifespan of a RBC. 90 to 120 days, right? 90 to 120 days. And remember we talked about, that's why we check A1C, because A1C is checking basically for the last 3 months what your blood sugar has been averaging, right? Instead of just, right, I took my blood sugar this morning, it was 92, and such, but that just meant right at that moment, right? I can go eat a bunch of M&Ms or something and shoot my blood sugar up very quickly, but for that moment right before. But if I look at my A1C, that tells me over the last 3 months, what has my A1C been running, right? So it's a much, much, much better gauge of how my blood sugar is doing over a long period of time. That's why the diabetics are always checking the A1C, okay? But anyway, the white pulp, lymphocytes suspended on the reticular fibers, red pulp, worn out red blood cells, and such. Huge number of RBCs and macrophages, right? Before, if you got in an accident, anytime you're in a car wreck or something, a motorcycle wreck or something, it's very common to hit, if you hit your chest real hard, right? The spleen can rupture. You get a ruptured spleen, okay? And years ago, splenectomy, rip it out. It's bleeding bad, rip it out, right? And nowadays, because of its immune function, they're smarter. And what happens is they'll do a CT scan on you and go, oh yeah, it's got bleeding of the spleen. But then they'll usually wait maybe 12 hours. If you swell up more and hurt more and hurt more and hurt more, they'll do another CT scan and see if it's swelling, see how bad the bleeding is. If it's bad, yes, they're going to do a splenectomy. They're going to cut it out. But they have found that many times, after a period of time, they don't have to cut it out. It will seal up, right? And stop bleeding and such. I know I follow a guy that rides a KLR and just zipping along, hit some gravel, and the guy pulled out in front of him, and he went down, boom, and he hit, I can't remember which side, anyway, one side of his chest there on the pavement, and ruptured his spleen. Thankfully, there's a paramedic that showed up and said, yeah, you need to go to the hospital, and they took him to the hospital and CT scan, and 12 hours later, it's CT scan, and 2 days later, another CT scan. It stopped, so he didn't have to have it cut out, but it's very common, okay? But they used to do that just routinely. Oh, cut it out. Oh, by the way, if you have your spleen cut out, then the bone marrow will take over. This body of ours is so amazing. If the spleen's gone, guess what? Another part of the body will take over that function, okay? 2, if you are, the spleen is the largest lymphoid organ in the body. That sounds like a Hesse question. The largest lymphoid organ in the body is the spleen. Okay. And oh, by the way, children, if they injure their spleen, usually if they're less than 12 years old, it'll just regenerate and grow back. Okay. Okay. Now, let's talk about another lymphoid organ, and that is below your sternum. Here, there's a gland, right, called the thymus, Thymus, right, the thymus. Like the thyroid, it is bilobed. If you look at it from the front, it looks like this. 2 lobes, okay? And that, it is underneath the sternum, right up underneath your breastbone, your sternum, okay? And it is the maturation site of T cells, okay? It's the maturation site of T cells. And what happens is when you get 18 or 19 years old, okay, and after puberty, then what happens is it begins to atrophy. Atrophy after puberty, right? Starts to shrivel up, okay? Now, I had a patient years ago and he was a farrier. People know what a farrier is, right? Yes? No? Maybe? I don't know. Please tell me. What? No? Farrier is a horseshoer. Okay? He's a horseshoer. He was having some symptoms, and horseshoers, they have to bend over and they squeeze the horse's hoof between their legs while they're shaving on it and working on it and nailing the shoes on, right? So they had to bend over a lot. So horseshoers have back problems, especially really tall ones. This particular guy, he was really short, so he didn't have to bend over so far like I would. But anyway, so I would give him a treatment every once in a while. And he came in one day and we talked about, he had some other symptoms. And I said, I think you need to go to your doctor and have this checked into and such. And so I knew that he had been to a cardiologist before and such. And so sure enough, he went to the cardiologist. He told the cardiologist the symptoms that he was having. And the cardiologist ran some tests on him. And sure enough, he had a cancer, and he had a cancer very unusual of the thymus, right? It had never gone vesidual and shrunk up, but it had gone cancerous. So he had the surgery, and he took around to chemo, and he was good. He lived for many years and finally passed away. But anyway, he had a cancer of the thymus, which is, I think, pretty rare. But anyway, interesting, right? Okay. Okay, and again, make sure you get this. The thymus, right? The thymus is a maturation site for the T cells, not the B cells, but the T cells. Okay? T cells, right? Now, let's talk about MALT. M-A-L-T. Mucosa associated lymphatic tissue. MALT. Okay? Basically, right? Your mucosa, right? The lining of your mouth, the lining of the GI tract, the mucosa. Yes? Well, it has lymphatic tissue in it as you go along. Right? And it says lymphatic tissue located in the mucous membranes. It protects us from the never-ending onslaught of pathogens. Okay? And first we'll talk about tonsils and Peyer's patches and your appendix. Okay, let's talk about appendix. Let's talk about these, right? Okay, first the tonsils, right? You got your palatine tonsils at the back of your soft palate. And those are the ones that get infected and we got a sore throat, oh, and it hurts to swallow, okay? The palatine, right? We also have lingual. Lingual means tongue, right? We also have, and there's pictures of these in the book, but at the back of the tongue, down low, we also have some tonsils, okay? Now, the next one is called pharyngeal, P-H-A-R-A-N-G-E-A-L, right? Remember the back part of our nasal cavity, the nasopharynx. On the back wall of that, we have these tonsils, and they're called the pharyngeal tonsils, but a more common name that we use is adenoids, right? And many times little children, their body's bigger than their head, and their head is slower to catch up, and they have big adenoids. And when they have big adenoids, they talk like this, and it's really funny to listen to them talk. I can remember my mom saying, oh, that kid needs his adenoids taken out, you know? But when his skull grew bigger, then he wouldn't sound like that. but you see a kid like that, and they usually are mouth breathers because those big tonsils are so big they have trouble breathing through their mouth or through their nose, and so they're mouth breathers. Usually the mouth breathers stick their tongue out a little bit, don't they? Don't they? Right? Yes? And so, anyway, they have a particular sound, yes? And when they sing, they sound like Willie Nelson. But anyway, okay. Right? Now, the last one is tubal tonsils. Don't hear much about these. These are wrapped around the eustachian tubes, or the pharyngeal auditory tubes. But I learned eustachian tubes. But anyway, those are tiny ones back there that you don't hear much about. Okay? Now, if you've ever seen someone's tonsils, who's had their tonsils, they cut them out and put them in a jar for them, right? They have little creases, yes. And what happens is they have tonsillar crypts, C-R-Y-P-T-S, and they have little, I don't want to say dents, what's the word? The word is invaginations. It's kind of like grooves or something like that, basically. But anyway, what happens is that it will trap germs there in those. And you think, golly, why would we want to trap germs there? We want to trap germs there so it doesn't go on through and cause us problems, right? Because usually we get the sore throat, we know we're sick. Does the sore throat usually cause major problems or whatever? No. Do they do a lot of tonsillectomies anymore? Years ago they did tons of them, now they don't hardly do them because that lymphatic tissue is important. And if you get a sore throat, you know you're sick and you stay home and you take care of yourself and you get better, right? Versus if the infection goes elsewhere, right? And it's annoying and it's a pain in the rear, but you know, this kid's got a sore throat, he's not gonna die, right? Most of the time sore throats are caused by viruses more than bacteria, right? So most of the time antibiotic, you're wasting your time with an antibiotic. But anyway, we have these tonsillar crypts, grooves, invaginate. We get the same word, vagina. But anyway, grooves, indentations, or whatever. And again, germs will get caught in there, right? Have you ever coughed real hard and spit up hard, crunchy stuff? That's stuff coming out of these, right? It's been in there for a while and you coughed it hard enough to get it out. Tonsillar stones, it's called. Okay? But anyway. Okay. Now, your appendix, right? Yes? Small intestine dumps into the cecum, ascending, transverse, descending, sigmoid, and rectum, right? Yes? Right? Hanging on the cecum, you have lower right, you have your appendix. Yes? Okay? It says the appendix destroys bacteria before it can breach the intestinal wall. There are many lymphocytes in there. It's a lymphatic organ, right? And B cells and T cells, right? And these have memory, okay? What does that mean? They have memory. They develop memory cells, okay? That means this, basically, right? You know, when you're a little kid, you first go to school, every other week you got a runny nose or a sore throat or something. It's very common. But then in time, you've been exposed to many different viruses and bacteria, right? And you don't hardly get sick. Your kid, you first send them to school, right? I guess I should say kindergarten, for those of you privileged people who got to go to kindergarten. But anyway, does mom get sick every week when the kid brings a germ home? No, not usually. No. Why? Because mom was exposed to all that junk when she was little, and so she's probably not going to get sick, right? and such. Memory cells are cells that can produce antibodies very quickly to germs that the body's already been exposed to, right? They keep making a big deal about this COVID, BA5, blah, 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 BA6, blah, blah. Yeah, okay, well, if you've already had it, there's about I heard last week, 88, 90, 92% chance that you're going to be protected from it, right? Because you've already had the COVID. You've already had it, right? Djokovic, they won't let him come play tennis in America because he hasn't had the shot. He's had COVID like 3 times, but they won't let him come because he hasn't had the shot, by the way. Right? Oh, by the way, we promise, if you get 4 shots, then you won't catch it, you won't spread it, and you won't get sick, and but anyway, sorry. Okay. Finally, Peyer's patches. P-E-Y-E-R. Oh, by the way, I'm sorry. I digress. Who has appendicitis? What age group has appendicitis more than any other age group? Very young people, middle-aged people, old people. Who gets appendicitis? Older people. Okay. Middle age? Okay, that's a no and a no. Thank you. Okay, let me explain. The appendix, we talked about how it hangs here, and the appendix, when you're very young, like you people's age, guess what? The hole here, right, is the biggest of your entire life, and so more common to get clogged up, get germs in there, and get appendicitis. So teenagers usually have appendicitis or early 20s. Now, that's not to say, I have a sister-in-law, and her dad had it when he was like in his middle 70s, and my friend Carlisle, he is mid-50s, and he got it last year, right? But as a general rule, appendicitis, no, you're talking 16, 17, 18, 19, 20, 25 years old, okay? Okay, Peyer's patches, right? Peyer's patches, you need to look at the picture in the book of these. Let me see. Okay, basically they are in, well, I'm in the wrong chapter, I went too far. Here we go. Figure 19.5, Peyer's patches, right? Aggregated lymphoid nodules in the small intestine, okay? In the small intestine, okay? Large clusters of lymphoid follicles, similar to the tonsils, but they're in the wall of the distal small intestine, okay? The wall of the distal small intestine, right? Okay. Now, has everyone turned their paper in? Yes? Good. Okay. Now, realize we're getting close to the midterm. We have, when we get past chapter 20, that will be the first half of this course. We'll already be halfway through this, right? And so very quickly, I haven't got my calendar out and figured out the date yet. And I'm sorry, I have not graded the things too because I've been just blooming busy, but I will try to do those. If I'm not busy at work, I was very busy today, but if I'm not busy, I will try to do those tomorrow at work and such. But any questions about what we talked about tonight? No? Okay, see y'all tomorrow.
Okay. Another setup? Oh, I got it.
No, and I told her, I was like,